Hello, I'd like to share some information with you today in regards to some physical symptoms of anxiety. This information is coming from verywellmind.com, written by Deborah R. Glasloff, and medically reviewed by Stephen Gans. So, anxiety brings about psychological and physical symptoms, both of which can feel overwhelming. Anticipating future threats, the body gears up for fight or flight moments. That's when the brain activates the heart, lungs, and muscles, so you'll be ready to engage or flee. With that, the heart beats faster, you begin to sweat, and your muscle tenses, among other involuntary responses. There are several types of anxiety disorders. A look at the physical symptoms may be experienced with generalized anxiety disorder, or GAD. Can give you a sense of what is possible. So what can happen is muscle tension. So that's described with people with generalized anxiety disorder. On the other hand, may include unrelenting aches and pains and overly active shoulders, back, neck, jaw muscles. These manifestations of muscle tensions do not subside in the absence of the threat. Rather, they persist until specific relaxations or mindfulness skills are employed. Also, digestive problems. The gut also holds and expresses anxiety. This can take the form of non-specific unsettling of the stomach, outright nausea, diarrhea, and or constipation. Digestive problems can particularly have a negative impact on day-to-day functioning beyond being uncomfortable and possibly disruptive in its own right. The symptoms may perpetuate worries about presence of medical illness. So there's also headaches and dizziness, thoughts of maybe racing and spiral of anticipation and fear of a topic, situation, experience, or may bounce incessantly from one issue or scenario to the next. This psychological experience can result literally in aching head and or dizziness. Also, edginess. Edginess is associated with generalized anxiety disorder that can manifest behaviorally as irritability or physically as trembling and or shaking. The fidgeting or the restlessness may be more obvious to observers than the person experiencing it in some cases. Also, there can be fatigue. Chronic worries can be exhausting, and so it's common for people with generalized anxiety disorder to feel fatigued. But sometimes the worry or other physical symptoms of anxiety make it difficult to fall or stay asleep. For people experiencing mild sleep disruptions, anxiety treatment is likely to involve changes in bedtime routine. Also, a person can experience shortness of breath. Shortness of breath as an anxiety symptom is also likely to occur as part of a panic attack, not in uncomplicated generalized anxiety disorder. So the word or what to take away from this is physical symptoms are considered a manifestation of anxiety if they're not better explained by the presence of a medical condition that's important. Thus, careful evaluation by both medical professional and mental health provider is the most assured way to distinguish their cause. Anxiety disorders can be quite common and often go undiagnosed and untreated. Talk to your doctor if you're experiencing symptoms, since anxiety can increase over time. Early intervention can improve your daily functioning and mental well-being. The physical complaints that are symptomatic of anxiety problems are no less uncomfortable than ascribed to a medical condition. Fortunately, as you undergo treatment for anxiety, the symptoms and tools to cope with them can and will improve. So if there's someone, a loved one that you are aware of that's struggling with anxiety, you could definitely contact SAMHSA and also seek the assistance and support of a mental health provider after ruling out any medical conditions. So I hope this information was of assistance today for you, and you enjoy the rest of your day.